right, y'all, good morning. Welcome. Thank you for coming. We have a momentous occasion for y'all. Now, nobody wants to show up on Saturday and hear a doctor talk for a few hours, least of all me. So we're gonna have a very engaging panel discussion for y'all. This is open-ended, this is a conversation. So we're not lecturing, we're all just talking. On the panel, off the panel, we're just exchanging knowledge. Everyone learns, everyone grows, all right? Let's hit the next slide here. So a quick thank you to everyone involved. Ortho Virginia, of course, for helping us put this together. Erin Barlow, can we get a round of applause for her? She made this all happen. The space, the refreshments, everything here. Henrico Sports and Event Center, of course. Sherma Francis, my PA, will be in the back here. If you can give her a round of applause. Now, she's got a surgical demonstrator, so everybody looks online and says, man, I could do that, doc. Today's the day. She can show you. So you can play around with that if you like at any point. Jen Beach, my athletic trainer, is here as well. Any questions about sports? Come on. Let's go. We have Smith & Nephew Sports Medicine, Sam Bowman representing. If you have any, there you go. If you have any questions about surgical instruments, he's got plenty to demonstrate if you'd like to see it at any point. Stryker Sports Medicine is helping too. They're not here in person, but they have an educational poster in the front if you want to go check that out. And then Morissette Media will be helping us with, recording this momentous event for Forever Reference. And OrthoVA podcast, I have my friend Larry Merritt, who's going to be emceeing this whole thing today. And so, without any further ado, we'll get started. So let me bring Larry up. And if you want to help us introduce our first panelist, we'll get started.
Good morning. Like I said, everybody don't want to be on a Saturday, so thank y'all for coming out today. I'm going to go right into introducing our sports injury and prevention panel. First will be Dr. Marquia Jones, Dr. Sarah Simoff, Dr. Lance Bennett, and Dr. Sean Dolan. Let's give a round of applause. Good morning, guys.
Good morning.
How are you guys today?
Great. Doing well.
Good. Well, we're going right into it. We're going to go directly to sports injury prevention in young athletes. And the first question is, what are the most common sports injuries you see in young athletes today, and are they preventable? And we're going to start with Dr. Jones.
You grab the microphone.
Good morning, everybody. I would say for me, like overhead injuries, especially with like pitchers, as far as baseball or quarterbacks, you see a lot of that repetitive motion, and just labral tears is definitely something that has come up a lot in my clinical and rehab process. So that's definitely one thing that I see a lot.
Hi, I'm Sarah. We see all that too, and also just throwing in the lower body, ankle sprains, ACL tears. And then the second part of your question was, is it preventable? Yes. I don't know that all injury is actually fully preventable, but you can certainly make it so it's less likely to happen with proper strengthening and training and cross-training. I think that would go with any body part injury.
I would kind of agree with Sarah on the back end of just like, not all injuries are preventable. Like, things are going to happen. I mean, sports is such like a complex and dynamic environment. But like, again, to her point, we can definitely do things to reduce the prevalence of those things, or the incidences of those things happening as frequently or as consistently. But to the first part of the question, I think things that I see most often are just generally overuse injuries. For me, I see a lot of like overuse knee injuries, and a lot of like young and adolescent athletes, right? A lot of repetitive jumping and landing and cutting and change of direction over so long of a season, right? A lot of athletes are playing with their school, or they're playing with the club team, and so they're playing over the course of a 12-month year. And we just see a lot of just chronic overuse within the knees. That's just something I see a lot more clinically.
Good morning. Yeah, I would probably echo everything that's been said so far. The only thing that I would add is like bone stress injuries or injuries to like growth plates in adolescent athletes or something to be on the lookout for. But as it goes for prevention, I don't really have anything else to add. I would agree with pretty much everything else that's been said.
Good. We're going to go in the same order. The second question, going back to Dr. Jones, is going to be, how does early specialization in one sport impact young athletes' risk of injury?
That's a good question. I would say just sometimes when you focus on one thing and not trying to vary the sports that you're participating in, you can definitely have that overuse again that can lead to that injury. So just trying to have some variability in the sports that you're playing definitely can prevent those injuries. But as Sarah mentioned, sometimes it's not always preventable. So it's kind of hard to pinpoint that one specific thing.
Ditto.
Great answer. That is the type of answer that I would give. I like that. We here.
Yeah, I don't have much to add, but I do think that like playing multiple sports, moving in different planes of motion, like trying different movement patterns definitely helps with like motor pattern recruitment and neuromuscular control and like really developing the anatomy and the biomechanics of moving a little bit better in younger athletes. So I'm always an advocate of like playing so many different sports and not necessarily like running through the same movement pattern over and over and over again with maybe not the best mechanics at that time. So it definitely gives you a little bit more into like the competitive nature of sport as well, playing different sports and like becoming a true competitor and an athlete. I think those are also like components that can definitely be improved outside of just, you know, what happens physically.
Oh, Dr. Dolan. Oh, you guys, okay. Okay.
He's a ditto too.
All right. See, we here. All right, this is the third one is, I like this question here, so I'm really interested to hear your responses. Going back to Dr. Jones, what role do coaches and parents play in injury prevention? And the second part of this, how can they be more involved in the athlete's well-being?
I would say as far as coaches and parents, just building that rapport with your child and your athlete, listening to their concerns, their complaints. If they're, saying that they have an ache or pain, definitely take that seriously early on versus allowing that to linger on and then it turns into something more serious. Just as far as injury prevention, doing your research. So if they're complaining of some type of ache and pain, getting that appointment with their PCP to see if they need to be referred to an orthopedic just for that further evaluation is definitely important. And also just being an advocate. So making sure that your child is, adequately nourished as far as their pregame meals, their warm-ups, just that whole cycle and rehab process, making sure that they're doing the right things to prevent those injuries are definitely important.
I also think that educating yourselves, if you are a coach or a parent, on what maybe has changed since you were an athlete yourself. I know a lot of coaches, we hear from patients that I have now, like, oh yeah, well my coach doesn't. We kind of stretch, we kind of do some warm up, but we mostly get into it. And I think there's a big miss that we have in the healthcare community from actual, like what Marquia said, like the research on how to, sort of prevent as much as we can injury versus what the coaches are, how they're coming at it more from a performance standpoint. I think there's a big gap there. So education to the coaches is huge. And then trickle down that to the parents. And having the parents understand that it's not push, push, push. There's not a whole lot of research out there right now that shows that like to be an elite athlete, you have to be, one lane zone. And a lot of professional athletes could have gone pro in multiple sports. They train in different ways. And I think that just shows that there's a big benefit to being a multi-sport athlete, and having that growing up can only, potentially make you actually more elite than if you specialize. Yeah.
Are there specific muscle groups that people should be working on of all ages to try and prevent injury?
Yeah, a lot, all of them. No, I think the core is super important. The power of your body comes from your hips, your glutes, your core. So that, I think, often is neglected. Many things that we do in life are forward in front of us. You know, we get strong moving forward, we climb stairs forward, we walk forward. You know, you don't see many people just like crab walking down the street. You're not moving sideways. In sport, yes, you do, but if you're not training in those different planes, then when you get in a situation where you have to cut, you have to pivot, you have to shift, if you don't have the support through core, glutes, hips, kind of your middle, that can lead to more injury. And then, you know, all up and down from there too, but I think it starts in the center.
I guess to the original question about, you know, coaches and parents and their involvement, I definitely think like being an active listener to whatever your athlete is telling you is super huge, and taking their concerns to be valid, because they themselves are an individual, and although they may be young, but they know their bodies well, they know what shouldn't hurt, they know what, you know, the difference between like pain and injury, right? So taking those concerns into account to then also actively seek resources to provide opportunities for them to be relieved of pain or get those corrective exercises or get the things that they need. So those, I think, like the first thing. But then also is like coaches, whether you are a like sport coach or like a head football coach, or if you are a sports performance coach or a trainer, right? Just doing your due diligence of always trying to like stay up on the most update like methodologies and techniques, and like trying to seek out resources to become a better like tactical coach, or in terms of like coaching and leadership and how to like lead athletes and you know, create an environment where they feel safe to like confide in you, to say, hey coach, like I am in pain, and not be worried that like the first thing you're gonna say is like, all right, go to the bench, like you're not playing anymore, but like create a space where they can kind of like advocate for themselves in that way. Even outside of just the physical aspect, but even the mental aspects, like you want to be a well-rounded coach. And then those are ways that like you can help them perform better, but then also like create a space for them to like thrive as an athlete. And then parents, like also just educate yourselves as well, seek out resources, seek out, you know, healthy providers that are like taking your child's well-being into care outside of just what they present, right? They're not just an ACL, but, you know, they're Sarah, who plays at, you know, Cosby High School, who, you know, like has things that she's interested in outside of sports. So you want to look for a well-rounded practitioner, and someone that's going to really give like your athlete the time and care that they deserve.
Yeah, I mean, again, saying ditto to everything else that was just said, but going back to what you were just talking about too, even adults have a hard time explaining what they're feeling sometimes when it comes to like pain and injury, so kids are definitely gonna have a much harder time with that. Mm-hmm. And it's important to remember too that, you know, kids are not little adults, kids are kids. So that's always something to keep in mind when you're having these conversations with your kids, and if something does feel off or something does hurt, it's worth taking that seriously and worth considering that and then going where you need to from there. The other component to this too is that, particularly with youth athletics and with kids in sports, it's always good to kind of circle back to what is the goal of them participating in this. And for a lot of kids, they're just doing it to have fun. So there's no need to like be in excess with the amount of training or the amount of competition that they have. So I guess what I'm trying to say here is that in the case of injury, like trying to push someone through that injury or trying to have these kids kind of fight through it, or, you know, them being stubborn, you have to weigh the risk. Is it worth it at this point? Am I risking burnout and then not having enjoyment in sport, and then I kind of ruin this for them? So just another thing to keep in mind, I suppose.
Question number 4. Dr. Jones, can you discuss the importance of proper conditioning and strength training and reducing injury risk?
I would definitely say that's a very important part of just your preparation. Obviously, you don't want to just get up and start playing whatever respective sport that you're participating in. You have to train your body. You have to, you know, go through your conditioning, do your warm-up, stretch to make sure those muscles are able to perform at the highest level possible. Because when you don't, then that's when you have that increased risk of injury. So again, like Lance mentioned, just, you know, having those coaches that, you know, are trained and definitely skilled in just making sure that the athletes are in a position to know what are the right stretches, what are the right conditioning programs in the off season to make sure that they are doing those right steps to prevent those injuries are definitely important.
And I would add that sometimes you have to break it down to then build it up. So getting the basics down, getting stronger, getting, more flexible mobility will actually make you perform better in your sport. So when we have patients come to us, sometimes they're like, well, this is all we're doing? Like, why are we just, doing this? And, we have to explain to them that if you don't have the foundational support there, your body is not going to do what you're asking it to do in a functional realm. So that goes to the strength and conditioning stuff, and that has to be hand in hand with the sport. Otherwise, you could be a great athlete and just continue to be a great athlete, but if you want to be, extra great, you have to have that strength to support what you're doing.
Yeah, I agree with all of that. It is just preparation and planning, right? Like, we don't necessarily have to overcomplicate strength and conditioning, but we definitely have to make sure that what we're putting them through meets all of the physical demands of that sport, the movement demands of that sport, and then the energetic capacity of that sport, right? That they can do that over and over again and do that safely. But if we're planning appropriately and implementing that plan, and also the consistency of it, I think that's one thing of building the foundation, but then also building the consistent pattern, right? A lot of kids don't warm up consistently, as they've mentioned, but then also the intent of warming up, right? They don't quite understand why they're doing it. They do it very passively, they do it very lackadaisically. But if you take the time to say, hey, look, this is going to be about 10 or 15 minutes where you can get your body prepared to do what you want it to do at the highest level, and then also take this time for you to mentally prepared to do that as well. So taking the foundations, but then also really taking the time to explain to them what that means. And then just having a plan and sticking to that plan if you're a coach, and, making sure that you're observing if that plan works, right? Are my athletes getting better? Are they performing at a higher level than they were before? So yeah.
Yeah, I think from the strength and conditioning side of things, developing a more robust athlete and a more resilient athlete, while the link may not be necessarily super clear as it relates to injury prevention, I would argue that a stronger, more robust person is probably going to be more resilient to injury. And kind of what Sarah alluded to earlier, good football players have one thing in common, they're all good athletes. And while not every athlete is going to be a good specific sport participant, good athletes are good athletes across the board. So developing that early as a means for injury prevention, but also as a means for sports performance, it's paramount, I would say.
This is another great question. Question number 5. How does technology such as wearables and data analytics contribute to monitoring and preventing injuries in youth sports? Dr. Jones.
No variability.
Take your time, take your time. Take your time.
I would say that they definitely help just really pinpoint any deficits so that you can address those and just really break down that process and build it back up. So I think that, having those data analytics, you can just really focus on that main deficit and just see how you can best rehab that to make sure that they're able to perform at their highest level.
And wearables can track your heart rate, your sleep, and all that kind of stuff goes into how you perform too. So it might be a good key for an athlete if they're able to see for themselves what they're actually doing, how they're actually performing, not just on the field or the court, but kind of in life. It just gives them good information. Having it on your wrist is not going to necessarily change who you are and what you do, but just having as much information as you can, I think actually can help us and impact us going forward.
I don't know if necessarily wearables would make a huge difference in terms of reducing injury risk. Unless you have a particular athlete that it's really taking things serious and wanting to monitor their sleep pattern or stress pattern with certain wearables or their heart rate. I think in terms of general data analytics, taking consistent measurements of the tests that you run or your protocols that you run. Things like force plates and stuff at a higher level can give you a lot more data analytics in terms of performance or asymmetries. But in terms of just injury risk with wearables, I don't necessarily know if that may make a big difference. But if we are having access to certain technology, then that we can look at different trends, and we can look at different mechanics, and then correlate that to research to see where an athlete may fall in that injury risk profile.
Yeah, I'm not sure that the evidence that we have for wearables right now is super, super clear. It's still kind of muddy with adult athletes and elite athletes, and I would say it's even muddier for adolescents and youth athletes. But to your point, stuff like dynamometers, force plates that measure outputs might be more useful. But I think what wearables are attempting to do is to highlight principles as it comes to training. So are we getting adequate recovery, for example? Are we progressing load and intensity in an appropriate manner? So it's highlighting a principle, but I don't necessarily think that that in of itself is as necessary for injury prevention.
Good responses. I'm gonna switch it up. I'm gonna switch it up as one. Doc Bennett, I'm putting you on the spot first this time. All right, question number 6. How do you educate young athletes on understanding and listening to their bodies to prevent overuse injuries?
I think for me, just like conscious repetition, like I spend an hour with my athletes, so it does give me an opportunity to like learn them a little bit better. But then also just kind of like asking questions constantly. Like they really do get tired of hearing like, hey, how's that feel? And then, all right, describe to me what that feels. So like the description to me is something that I really try to educate like athletes on. Is like, hey, give me something better than it feels good, it feels fine, it feels okay, it feels all right. Like, let's dive a little bit deeper in terms of like what that means, so that when you're out there on the court or when you're out there on the field, you can now give your athletic trainer a little bit better of a description of what it feels like. You can give your head coach a better description of what it feels like, or your parent. And then from there, we can kind of like identify patterns. Like, all right, cool. Are we in a safe zone of discomfort that we know we won't flare them up? We know they can perform well. They know they can perform well, and they now have a better tune in to say, hey, coach, like this may be a time where like I might need to sit out and let me go talk to the athletic trainer and grab some ice, because I felt this before and I know this may lead to a little bit more discomfort down the line. So like asking the right questions, asking those questions consistently, and then understanding you're dealing with young athletes who want to play. And so like there is a level of like, hey, they're going to try to lie to you at some point, and so you have to use your clinical eye to see like how well are they moving and like what patterns are looking a little bit off, despite them may telling you like, oh, everything is fine, everything feels good, but like there's a fine line there.
I'm gonna go with Dr. Dolan, and then we'll come back to the ladies.
Yeah, I suppose I'm in kind of an interesting position that when I get kids that are already kind of hurting, it's like, well, I mean, don't go to that place again and you'll be okay. But I think to your point too, building rapport with your athletes is probably the most important step. And then once you have rapport with them, there's trust. And it's easier to have that dialogue back and forth with them that way. But setting something like boundary conditions is like, this is what the upper limit of what you and I are willing to work through or tolerate. That's what we stay under. And if you can set that, I think kids have a pretty good intuition to what feels good versus what doesn't. So as long as you set those boundary conditions and they have trust in your decision making and trust in what you're doing, I don't really think you can go wrong with that.
Dr. Jones?
Just to add to that, I would just say also educating the young athletes. A lot of times they want to know why. So when you provide that research and that education to them, they hopefully have a better understanding that we have their best interests, so that once they understand, why they may not need to further try to push themselves through an injury, or knowing what's their norm and what's outside of their norm. And like it was already mentioned, this building that rapport, that communication, allowing them to have that safe space with you or their coaches or athletic trainers to know, okay, if I go to this person to, confide in them or let them know that I'm not feeling something that I shouldn't be feeling, that I won't be frowned upon or I won't be condemned, that I'm okay, that I can, rest, or I can sit this one out and still bounce back with the rehab and proper conditioning. I think that's definitely important.
Yeah, I mean, I kind of echo everything that they all said. And yeah, we'll just leave it there. Good rapport, knowing what things feel like, make sure you're not pushing past the threshold. I feel like those are the 3 keys.
But we're gonna start with you with this question.
thing.
I like to keep things simple.
Okay.
So this is the last one, number 7. What are the early warning signs of burnout or overtraining that could lead to injury? And how should they be addressed? I would love to hear this response.
Yeah, I think that's a really good question. So burnout, I think, can manifest itself in a lot of different ways in a lot of different people. So one, knowing the kid and seeing how they are. If they start to feel like withdrawn, they don't want to go to practice, they don't feel like, going, they'd rather, go to McDonald's or something, then I feel like that could be a good sign of burnout. And then you can even take that a step further into like burnout in a mental health state. Like, are their grades slipping? Are they staying in their room? Are they playing video games all the time? Are they not really wanting to do the thing that used to bring them joy? Could be a definite sign of burnout. And then on the overuse side too, if they're coming home from practice saying, I'm hurting, my knee hurts, my foot hurts, my shoulder hurts, and you're like, just keep going, keep going, keep going, and they keep coming home saying that things are hurting them, that goes back to one of the previous questions that we had is, really listening to them and realizing they're probably telling you the truth and they need to go see somebody to figure out what's going on because they're probably overusing. And then the last piece of what I'll say is, excuse me, sports are for the person doing the sport. It's not for the parent, it's not for the coach, it's not for the community. If the person, goodness gracious, sorry. If the person competing, participating in the sport is not interested, they've hit that burnout, they're disinterested in it, they maybe are hurting, but they keep going because parent is pushing it or community is pushing it, or they have to get to college to get a scholarship to play to bring money or any of those things. It's not benefiting anybody and can just ultimately lead to like a downslope. And so I think that would be something just to keep in the forefront of your mind. Like the sport is for the person participating in it, and if they aren't doing it for them, just like anything in life, you're not going to have as good of a benefit, and then that can lead to the burnout and the overuse.
Good.
Sarah definitely mentioned some good points, but just to add to that, I would say lack of sleep. Obviously, rest is a big thing in young athletes. Of course, they have the social media and just social activities that they want to do, so making sure that they rest to be able to perform when it's game time and be able to, do all the things that their coaches need them to do, their teammates need them to do. If they're not able to do that, then there may be some early signs of burnout. Also, just that anxiety. Sometimes these kids, they are on this pedestal to perform and do everything perfectly. So just allowing them to be kids. They can have some errors here and there, but just making sure that, if they come to you with that lack of motivation or lack of interest, that you take those signs seriously and pull them aside and talk to them, allow them to have that safe space and the opportunity to, express if they are burning out or if they need some rest, if, they need to just kind of regroup, maybe go out for a social outing with the team versus always practicing or running or lifting weights, just allowing them to be kids and having that fun, make sure that the purpose of why they're doing that sport is still in the forefront and that doesn't get pushed to the back.
Yeah, I think they've made some excellent points in terms of like how to identify burnout and some of the like downstream effects of what that can create in terms of like overuse injuries. But one thing I try to ask like a lot of my athletes are like, hey, if you're not playing your sport, if you're not in school, like what are you doing for fun? Like what is it that you do? And there's so many of them who are just like, I play my sport, like that's it. And so like as a parent, always trying to like push that athlete to like figure out who they are outside of the identity of the sport. And I think that can create a space where the sport stays the sport stays fun, and the sport isn't like who I am, what I do, or like what I have to do, right? And I think that creates a little bit more of a longevity for them so that they can kind of keep that at the forefront. But like figuring out who they are and figuring out what they like to do outside of that could be a great space to like prevent that mental and like psychological aspect of burnout, which then therefore like the body can kind of follow that in a positive direction.
The only other thing I would add is that it kind of ties back to this idea of multi-sport or multi-activity participation. The novelty of doing several different things, I suppose it would make it less likely to be burnt out about one specific thing. But yeah, I would certainly echo what you just said too about the sport is not your identity, it's a thing that you do. And trying to identify, who you are as a person as a priority and using the sport as perhaps an avenue to get there is probably more important than putting all your eggs in one basket and saying, I am this sport effectively. So as a means to reduce burnout, I would say those two things probably.
Let's give these doctors a round of applause. Great responses. Now we're going to lead to our video ACL surgery demonstration, and then we're going to follow by a brief break.
Bear with me one minute.
Any questions for the panelists?
How do you best like to address fear after an injury to hopefully prevent another re-injury later on down the road?
I typically just try to remind my athletes of like past progress, right? Like every time we kind of get to a new milestone, it's like, hey, you remember that one time we tried this and like that was super nerve-wracking for you, and then now we're doing 3 times that, or now we're moving a lot better than that. So I try to use that as an opportunity where we can kind of like celebrate success rather than like focus on maybe what we can't do, right? And just try to like divert their attention. I feel like that has been super successful. And then when we get to the point of like competition, it's like, hey, you know, you did do that practice, right? Like we've been practicing for a few weeks to months, or, you know, we've been doing some like soft re-entry to sport and like giving you a couple of like nuggets to keep going. So just letting them know that they've succeeded so many times in that journey to like get to where they are. So like this would just be another opportunity to like show themselves that they can succeed at that too.
I think it's probably important to ask them what it is that they're afraid of or why they're scared, and maybe start there. But I think if you're doing all the prerequisite stuff leading up to return to sport, if you're checking all the correct boxes and you're showing them that they're doing everything that they need to from a recovery rehab standpoint as it progresses back to return to sport, you know, that confidence is kind of embedded in the process. So if your process is sound and your principles are sound, the confidence should be there. But I would say that, you know, having an open forum to ask them to express why they feel the way that they do, that's always a good starting point to kind of identify, are there some things that I missed from a rehab standpoint? Or are there some things that we're not addressing that they haven't quite been vocal about up to this point, and can we check that box now?
Just say one more thing. Sometimes you've got the tricky ones who they're so afraid that they won't do it, and in a very safe and appropriate manner, you can kind of trick them into doing some of the stuff that they are afraid of doing. You know, if they're afraid of, say, kneeling on their, you know, surgical knee or something, you're like, oh, can you grab that for me or pick that up, or, you know, just something silly, and then stop and be like, look, you're on your knee, you know, something like that. And then that sort of gets them a little more confident in their stuff. And then I use the phrase a lot, like, trust your leg or trust your arm, or, you know, trust something, like telling them that I trust them or their body part or whatever it is to do what they need to do sometimes makes them trust it, and then in conjunction with the other things that Lance and Sean said too.
And one last point, I would just say to not compare to other people or other athletes, to just trust the process of your own rehab, be confident in the people that are working with you and your plan of care, to trust that they are putting the right tactics forward to make sure that you are able to safely return to sport safely without re-injury, and just listening as a student and as a parent to just have everyone collectively involved in that plan of care and that rehab process so that everybody's on the same page is important to decrease fears, address any questions, and also ultimately educate everybody on what it is that we're doing and the why.
Any other questions before we go to the video?
In our CPG for the lateral ankle sprains, the authors recommend bracing prophylactic care for court athletes. Is that something that you guys like discuss or provide taping or anything like that for injury prevention with your athletes that you see?
Question one.
Know the athlete, right? Like, again, we kind of just talked about like fears. Like if you have an athlete and they're like super self-conscious and like they are a lot more worried about that, one, you like foster again that, hey, like we've done everything in the rehab process to provide you that stability, that control, right? We've checked all these boxes. However, if there's like a light sleeve that you want to put on and that just helps you mentally get back in the game, then we can use that for a short term, right? I leave it up to one, if we've checked all the measurements and we have really good data and like all those boxes are checked, and then two, right, knowing my athlete, like there are gonna be some that tend to lean toward that direction. However, if I'm understanding that, hey, like we are at no risk of anything happening to you, like let's go ahead and foster like that independence. Let's go ahead and push that because I don't want that to be a crutch that you lean on. However, if I understand this is a moment where this can be a bridge, right, to independence, then let's roll with that. But you kind of have to take it on an athlete by athlete basis. Anybody else?
And then I agree with that too. And then also just the rapport between the physician and the therapist too. A lot of times patients want to hear it from, especially if it's a surgery, patients will want to hear from their surgeon like, hey, yeah, you're good without the brace. And then if we echo that and work with the training and we know that it's, good, they're good to go without, then I think just having that good relationship and dual people telling them, hey, you're cool without, or yeah, you use it for a little bit. Sometimes that goes a long way too.
Anybody else want to respond? Yeah, good? Okay. Any other questions?
I spend a lot of time with seeing runners coming in and out of the clinic, and they have a difficult time understanding strength training versus their running when they get injured, having to step back. Can someone take a few minutes and describe to me how you would treat a patient like that in the clinic?
Take y'all time.
Yeah, so our first visit is always an evaluation. So you see where their weaknesses are. Even if they're a really strong runner, they're probably going to have some weakness elsewhere. I mentioned a little bit before, and we all know this, when you run forward. So a lot of times you're stronger, you're tighter on the front side of your body, maybe not so much laterally. So the first visit is seeing where their deficits are and then showing them where their deficits are and then saying, hey, look, you can run super fast, but when I hold your leg up to the side and push it down, like you can't resist me. So that is a deficit that is impacting your running. And so those are the pieces that we need to work on in the strength training to make you more well-rounded. Running is good, running is great. If it's not hurting you, don't stop, but add these things to it so that you can be more well-rounded and perform even better.
And just another thing to add, I also like to look at their shoes. A lot of times runners, they have their favorite running shoes or their go-to shoes, but you need to look at the wear and tear on those shoes. So if you've had them for more than 3 to 5 years, definitely maybe trying to go and get a new pair of shoes is definitely something to consider. Yeah. So it just all depends. That's definitely important. Sometimes the athletes and the runners don't always think that their shoes is the issue, but that can definitely cause that injury and overuse and stress.
It's funny. I wanted to add to that. It's funny that you say that because it's not even in runners. This is people, period. You see their shoes, they be all picked all over and stuff like that, and they be having the be limping. I'm like, and I'm a person, I deliver bread also, full time. But I'm telling you, I change my shoes like at least 3 to 4 months. Because once my feet or my knees start hurting, nope, time to change them up. So I'm with you on that.
Do we have any runners in here? So for your perspective, or from your perspective, I should say, how important would you say that running is to you as an identity piece? Very. So runners kind of across the board, I know we talked about sport being like an identity piece for a lot of kids, and we don't necessarily want that to be their whole identity. Runners are a whole different breed. That's a whole different type of person. So running is them. That's just how it goes. That's what it is. So to expect a runner to undergo an injury or to experience an injury and tell them, well, we got to pull back, that you're going to be met with a lot of resistance there, at least in the experience that I've had with runners. That's been the case kind of across the board. So obviously establishing good rapport is going to be a good first step, but then can you meet me in the middle with, we can still run. There's probably some threshold or some allowable amount of running that you can do that's not going to make this problem worse. If we can start with that and we can dose in some other activity to make you better at running, I think that's probably a good way to go about doing it. And at least that's what's worked for me in the past. I can always speak to anecdote, but hopefully that makes sense.
Good responses. Any other questions? Okay. You guys are off the hook professionals. Let's give them a round of applause.